Good day, class. In this video, we are going to talk about the true and false situation. As we talked before, that in some situation, some different syndromes can happen together. So at the same time, the patient can present with different syndromes. And these syndromes, sometimes they can happen together, such as Acterius cold syndrome. The patient can present with Acterius manifestations as well as the cold manifestations. But sometimes, if a patient presents with an opposite or a contrary manifestations, we need to identify which one is true, which one is false. So firstly, the true and false, cold and heat. It is because the floating yang, that's the deficiency yang, the patient presents as cold. As you can see from the clinical manifestations, the reason why we say it's true cold with false heat, why there's false heat. The reason is because in the manifestation, you can see both cold and heat manifestation, such as feverish sensation. The patient feel like kind of hot, but no burning sensation. Extreme cold of the lower limbs, so the feet or the calf. The patient can feel cold, so this is a cold symptom. Restlessness, this is a heat symptom. Flushed cheek, that's also a hot symptom. Thirsty but no desire to drink, that's cold. Sore throats but no swelling. Constipation but loose stool, but stool are not dry but not loose, but not dry. Constipation with dry stool, that's because of the heat will consume the body fluid, so it will present as dry stool, but now constipation with moist stool. Clear urine, that's the cold symptom. The tongue is pale with white coating. The pulse is superficial, large, rapid, but weak. So these are Acterius, these are heat, but weak. So as you can see from the manifestations, there are many symptoms that seems like on contrary to each other. The patient presents with heat symptoms. In the meantime, there are cold symptoms. The reason for this kind of manifestations in acupuncture theories that we think that's because the internally or interior, the patient have a severe extreme coldness in the internal or interior area. And in this situation, the yang heat cannot go in, so the heat manifests at a superficial level. So which means the true cold with false heat. The patient presents with heat symptom at superficial level, but internally it's due to the cold condition, the cold symptoms. How do you know the true and false? That's from the manifestations. You can see from the descriptions. You can see a lot of but, but. So the but is showing showing you this the contrast between the symptoms before and after. How do you know which one's true, which one's false? You should identify from the pulse. Also, you can consider which symptom is more central, more internally. The patient presents with the opposite symptoms. One is in the abdomen area, one is in the limbs or extremities. So we can consider the one close to the center, that's in the abdomen or chest area, can be or more likely to be true symptoms. Apart from the true cold with false heat, the patient also can present with true heat with false cold. This kind of patient will have cold hands, cold feet, cold or extreme cold limbs, a deep, slow pulse, will have fever, and palpable burning sensation in the chest and abdomen. So when you palpate the patient, you can feel very hot. Thirsty with desire to drink, foul breath, rapid breathing, yellow urine. So these are all heat symptoms. Red tongue with dry yellow coating, forceful, excessive, and large pulse. These are all symptoms with excess heat. But in the meantime, the patient presents with cold extremities, cold limbs. The reason why the patient will have cold limbs, cold hands, cold fingers, the reason is because the excess heat in the body, excess heat block the meridian. So the circulation in the extremities is not that good. The reason is the excess heat block the meridian. That's why you can feel the coldness or extremely cold hands and feet in the hands and feet, but not in the chest and abdomen. So that's how to identify which the true and false, which one is true, which one is the false. From here, you also can see that the four or five diagnostic methods are very important. You need to combine them together. You can't diagnose from the pulse only. When you see a forceful or excessive large pulse, or when you palpate the patient, when you shake the hand, you feel the patient's hand very cold. Now you can conclude to a summary that the patient suffers from a cold condition. You need to palpate the other area. Need to ask. Need to ask the thirsty. Is it does the patient have want to drink, or does the patient want to drink, or does the patient don't want to drink? So these are the combination of different diagnostic methods. So the cold and heat in the limbs, the skin, in the facial complex. The true manifestation, more in the center, 脏腑 organs. We don't see 脏腑 organs, but you can palpate the chest and abdomen, the qi and blood, body fluid. We also can't see these, but you can see from the manifestations, such as the thirsty, the urine, the property of the stool. So these are the true and false manifestations. Apart from the true and false coldness and heat, the patient also may present with true and false deficiency and excess. True deficiency with false SS. True deficiency, the pulse is deficient and weak. A pale white complexion. Loose throat. Why the patient can present or it can be misdiagnosed as false SS. That's because the rapid breathing, abdominal fullness and distension, constipation. These are the manifestations of excess. The reason for this excess is because the patient got deficiency in the Jiangfu organs, and then the deficiency will cause the deficiency qi and blood deficiency, and the qi and blood deficiency will result in stagnation, qi stagnation. That's where the abdominal fullness and distension come from. The constipation, because of the qi stagnation or the qi and blood deficiency, the, the qi in the body doesn't have enough force to move the stool. That's why constipation. So these manifestations are due to the deficiency. So when you see these kinds of symptoms, these kinds of opposite symptoms, you need to identify which one's true, which one's false. The true excess with false deficiency. The symptoms can have excess symptoms, but in the meantime, the patient will present as a destitute, reluctance to talk, weight loss. The reason for this kind of manifestation is due to the excess will also block the meridian internally, so the qi and blood could not move to the limbs or to the further parts of the body. That's why the speech, they don't have enough qi and blood, the patient presents a reluctance to talk. So these are some of the examples. How to differentiate the true and false, deficiency and excess. Firstly is the symptoms, the manifestations we going to identify. We're going to combine with the pulse feeling, as well as the tongue. The tongue's manifestations, such as no matter what kinds of manifestations in an excess syndrome, the patient's pulse must be forceful, such as the surging forceful. And if it's excess heat, the tongue must be dry and red. So that's the key diagnostic key points to identify the true and false symptoms. From the symptoms, that's closer to the center, from the pulse, from the tongue. Most of these symptoms and manifestations present in a more complicated situation. Syndrome transformation. This refers to the development of diseases. The development of the diseases in individuals can present with different syndrome transformation, such as from exterior to interior, or from interior to exterior. Can you show any examples for this situation? So for instance, a patient suffers from runny nose, from headache, from body ache for a few days. That's mostly due to the exogenous factors, and it can be exogenous heat or exogenous cold. And then after a few days, the patient loses their appetite. The patient suffer from diarrhea. So that's from exterior to interior. From interior to exterior. The example can be seen in patient present with fever, especially for kids. In some situations, the kids present with high fever and then with constipation, and after treatment, the patient can even have abdominal pain. So all these interior manifestations. After the treatment, the patient can present with rubella, so the rashes on the skin, and then the fever reduced. So that's from the internal to superficial. That's from interior to exterior. The cold and heat transformation. Can a cold syndrome transform into a heat syndrome, or a heat syndrome transform into a cold syndrome? The answer is yes. A cold syndrome, for instance, a patient suffers from coldness, and then the coldness will reduce the circulation, which will result in a stagnation. After long-term stagnation, the stagnation qi will create the internal heat. The cold syndrome develop into a heat syndrome also may due to the treatments. For instance, a patient suffers from joint pain after a long time or after taking some herbs or some treatments such as the moxibustion. After a long time, the joints may present with redness, hot feeling, or sometimes even painful. So this is from the cold syndrome to a heat syndrome. Also, you can see in some patients suffer from asthma. The patients suffer from asthma especially due to wind cold. Pale phlegm and thick, pale thin, perfumed phlegm, and then after long-term or after the treatment, the patient may present with yellow phlegm, yellow sticky phlegm. That's from the cold syndrome to a heat syndrome. The cold syndrome transforms into a heat syndrome, or from a heat syndrome transform to a cold syndrome. These two also can depend on the body constitution. If in a hot constitution person, the cold syndrome also will develop into heat. In a cold constitution patient, the hot syndrome also can transform into cold. So the heat also can transform into cold, can due to the constitution, also can due to the treatments or the wrong treatments, such as a patient suffer from high-grade fever, very hot in the body, and then we use different treatments. There's one treatment to reduce the fever is to cause diarrhea. So after we remove the stool from diarrhea, especially for after severe diarrhea, the patient will present with cold lumps, pale complexion, weak pulse. So that's from a heat syndrome to a cold syndrome. Also, this is an example from excess syndrome to deficiency syndrome. So that's the third aspect. If the transformation between the deficiency and excess. Deficiency syndrome transforming into excess syndrome. That's due to the deficiency, the qi and blood deficiency, the function of the organs. It results the qi and blood stagnation, and this stagnation can cause the pathological products. Will make the situation into an excess situation. For example, a patient with spleen and kidney deficiency. And then you cause a yang deficiency. And after yang deficiency, the patient can result into edema and then the water retention in the body. The water retention can present as excess. So that's from deficiency syndrome to an excess syndrome. So from these, here I only give you some of the examples. You can go through the textbooks or find some reference. You can try to analyze what's the cause, what's the development of the diseases, and what's the causes, what's the reasons for these developments. Try to analyze from our theory. So now we go back to our case at the beginning when we mentioned the gentleman presents with palpitation for 2 months, edema. So how to analyze the edema, palpitation, soreness and coldness in the lower back and fatigue, pale complexion, edema, abdominal distension. So how do we analyze these manifestations? This is an interior deficiency cold complicated by excess. This symptom become very complicated. Firstly, is interior deficient. Why deficient? Enlarged tongue and deficient pulse, pale complexion, fatigue, pale enlarged tongue, edema for 3 years. That's a long term. When you go back to the deficiency and excess, you will see deficiency always a long term, and long term always will result in deficient. So this is deficiency patterns or deficiency symptoms. Edema is the water retention. The water retention is the pathological products can cause excess. Palpitation. Palpitation we haven't introduced now. We haven't introduced in future when we study the 脏腑 organs. We will study the palpitation is from the heart function going to be affected. The soreness and the coldness in the lower back is the manifestation of the kidney deficiency. Abdominal distension, white, cold tongue coating, deep slow pulse indicate coldness. So from these manifestations, you can see that the patient presents as a combination of deficiency and excess, also cold. So cold, deficiency with excess. And when we study the 脏腑 differentiations, we can even identify the location, the kidney yang or kidney and heart yang deficiency. So that's how to identify how to analyze the clinical manifestations. We're going to use different manifestations, try to find out the causes of these manifestations. Okay, so here we give you one example how to analyze. And after studying the 8 principles differentiation methods, you can try to gather the clinical information around you and try to practice how to analyze and then conclude to a syndrome or pattern. The reason why the syndrome or the pattern is very important, the reason is because our treatments, either acupuncture treatments or the herbal medicine treatments, will base on the symptoms. So in the therapeutics, we're going to start from here. From this kind of syndrome, what are we going to do? Such as from this one, deficiency cold syndrome, we're going to tonify the body, we're going to tonify the kidney yang, we're going to relieve the coldness. So we can use warm herbs, or we can use masturbation to relieve the coldness. That's how to treat the disease. That's also why the symptoms is very important. Until now, you will see that our process of treatment. Firstly, from the clinical manifestations, we're going to use 5 diagnostic methods: inquiry, inspection, listening, smelling, palpation. And then we gather all these manifestations, we conclude to a syndrome. So that's or you use pattern. You're going to conclude the syndrome here. What's the gap between here? What's the bridge from the manifestation to the pattern? The bridge between the manifestations from different diagnostic methods to a pattern is the basic theory. So the theory we study, we're going to use the theory to analyze these manifestations and then to a pattern. From the pattern, we're going to continue the treatments. The treatments and then can go to herbal medicine or acupuncture. So that's the whole process of the practice, from the clinical manifestations to the treatments. That's the process of the all clinical practice. Thank you for your attention. From the next video, we are going to introduce another new differentiation method.